Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll. This is the healthiest half hour anywhere online today. Going to do our best to educate and inspire you for just a little while here on Facebook and on YouTube. On tap today, adopting a plant-based diet already saved Eric O'Gray's life once. But now, after contracting COVID-19, he says it may have done it for a second time. We're going to be hearing from Eric O'Gray, hearing all about his journeys back to health when he joins us in just a little bit. Also on the show today, we are going to be opening up the doctor's mailbag with Dr. Vanita Rahman. She is here to answer all of your health and nutrition related questions. So if you have a question for Dr. Rahman, go ahead and post that in the chat box now, and we will do our best to get you an answer before the end of the show. But first, let's see what's going on in the world. Here is a check on your health headlines for this Thursday, July 30th, 2020. The death toll from the coronavirus in the U.S. now stands at more than 150,000, officially crossing that mark Wednesday, as more than 1,400 deaths were reported. Florida, California, and North Carolina all yesterday shattering single-day records for fatalities. Those figures are likely to continue to climb in the coming weeks, but there are signs now that the spread of the virus is beginning to slow, with 5 states now reporting falling numbers of new cases, and that includes Arizona and Texas, which had been hard hit by the sudden surge of new infections after reopening. Meanwhile, the nation's top health officials, however, are urging residents to remain vigilant, exercise social distancing, and continue to wear a mask, pleas that are likely to be echoed until the pandemic is brought under control. In other news, New Jersey Senator Cory Booker is introducing a bill that would put an end to high-speed processing at slaughterhouses. Workers say the current speeds at which plants are operating are dangerously high, putting the safety of employees and customers in jeopardy while also unnecessarily endangering the welfare of animals. Employees say the rapid pace also makes it exceedingly difficult to maintain a safe social distance from coworkers, resulting in outbreaks at more than 370 facilities nationwide. To date, more than 200 workers have died and 38,000 others have become infected. Across the pond, the UK is hoping to combat COVID-19 by limiting advertising for junk food. The crackdown is happening both on TV and online, and it comes as mounting evidence shows a strong link between the risk of the disease and diet-related chronic conditions such as obesity and hypertension. Prime Minister Boris Johnson's plan would ban the ads from airing before 9 o'clock at night. About 2/3 of British adults are currently overweight. And finally, a lot has been made of the world settling into a new normal during the pandemic. And while the change of working from home and living in a lockdown can be jarring, it turns out that it didn't take a lot of us very long to get used to it. Researchers at the University of Maryland say they interviewed more than 120 people several times a day during the first 2 weeks of the pandemic here in the US to gauge their levels of stress and their emotional state. The results? Most had a sense of powerlessness early on, but over the next 14 days, the study finds people began to feel as though they were regaining control despite stress levels that were continuing to climb. The biggest improvements came from individuals who felt the most neurotic symptoms early on, including levels of depression, anxiety, and vulnerability, all of which subsided at faster rates. And right now, we are, in fact, going to keep calm and carry on as we turn the page here on the Exam Room Live. At one point, Eric O'Gray weighed 340 pounds. He was on 15 different medications in failing health, and doctors told him flat out that he would die if he didn't change his ways. And oh, what a change Eric made. He adopted Petey, his loving and faithful dog, from a local shelter, and together, they set out to get healthy by walking and by going vegan. Flash forward 10 years later, and now Eric says there is a good chance that eating a plant-based diet has saved his life once again after he was diagnosed with COVID-19. Eric is here now with us to share his incredible story and journeys back to health. Eric, thanks for joining us today, my friend.
Great to be here, Chuck, and thank you so much for having me.
Thank you so much for taking the time. And let me just ask you right off the bat, how are you feeling?
Feeling a lot better. I did put on about 20 pounds as a result of getting the coronavirus, but life has returned to normal, and I'm getting back down to my regular routines, and I'm planning to start, re-engage myself in running and the other physical activities that I was doing before the pandemic struck.
So let's talk about this. A lot of people wonder, well, I eat plant-based, I eat a whole food plant-based diet. I'm like next level vegan, super healthy. I know that you fall into that category after turning your life around. Was this a surprise to you that you were infected?
It's my understanding that everyone has an equal risk of contracting the virus, and that no particular lifestyle is going to give you an edge onto whether you're going to get it or not. In other words, the virus doesn't discriminate between different lifestyles. However, I believe that based upon the extreme level of health that I was in before I contracted the virus, that really helped me through and minimized my symptoms and helped me get through it in the shortest period of time possible. So what I'd like to say is that I was really in compliance with all the national guidance about what to do and what not to do, and the respect given on going out and wearing face masks and everything. And my wife and I were both pretty much in compliance. We were mostly staying at home and self-isolating, going to the grocery store about once a week, and maybe Lowe's or Home Depot every couple of weeks, just to get materials for home improvement projects. So we didn't do anything. There was no partying. There was no like going out and being in large crowds. We even self-isolated from a local family who was not living with us because we have a fairly significant condition here, and that's my wife's 96-year-old mother, who's going to be 97 next week. Everybody say happy birthday to Josephine Stagnaro. Who's going to be 97 next week, lives with us, and we wanted to be ultra careful so that we wouldn't catch the virus nor communicate it to her, because if we did, we feared the worst, rightfully based upon the guidance. So based upon all that, somehow we still contracted the virus, and we're in a fairly low communication area. We're in Lodi, California, the Central Valley of California. And it's not a hot spot, and it hasn't been a hot spot. So it's still a mystery as to how we got the virus. But as soon as we did, let me tell you, if you can possibly do anything that you can to avoid getting this, you don't want to get this. This was the sickest that I've been since I had meningitis at age 10. Extraordinary fatigue, like nothing I've ever experienced before, having to take 6 to 8 naps a day just to get through, just falling asleep, severe headaches, lots of gastrointestinal issues, and just really severe flu and cold-like symptoms, chest congestion, nasal congestion, lots of congestion, but really feeling like you wanted to lay on the floor and never get up again is how bad it was. And this continued. I got it. My wife got it about a day or two after I did. And this continued, I would call them moderate to severe symptoms for about 2 weeks. Now, so what we did immediately was we realized that we had this, or we suspected that we had it. So the first thing that we did was we tried to get an appointment to get tested. And so the appointment took a week to get. And you can go online and figure out how to get an appointment in your state if you suspect that you have this. But after we got the appointment, it was still a week after that before we got the results. So it was a week to get the appointment, a week after we got the results, and that had already been about a week into our initial symptoms. So we didn't get the results until about 3 weeks after we felt sick. But because we suspected that we had it, the first thing that we did was self-isolated in our home from my wife's mom, because we absolutely didn't want her to get it. And miracle of miracles, she didn't. We felt that by self-isolating in the home, because we have a fairly large floor layout and her room is on opposite sides of the home from ours, she's about 100 feet away easily. We felt that would be a lot safer for her than going into like a nursing home or some kind of like community facility, because we couldn't control that environment at all. So we successfully self-isolated from my wife's 96-year-old mom, and she did not get it. And it just, very thankful for that.
How long, well, how quickly did these symptoms come on? Did you start feeling sick and then a couple of hours later you were just flat out, or was it a gradual progression over a number of days?
I would say that within one day of initially suspecting that something was wrong, I felt like I got hit by a truck
Mm,
within about a
mm.
day. It was that quick and it was that severe and it stayed with us. So, all these folks out there are saying, well, I don't think it's going to affect me. This is not a big deal. This is a restriction on my personal freedom or whatever. I'm telling you, you don't want to get this. Because if you get this will change your life in one way or the other. I still have marginally lingering symptoms of like excess phlegm and things of that nature. I mean, it's going away quickly now, but it's been about 8 weeks since I first felt my initial symptoms. And I'm telling the listeners, it's worth the precautions. It's worth wearing the mask. It's worth social distancing. It's worth washing your hands. And if you don't do that, you're playing Russian roulette. Look at the example of Herman Cain this morning, you know,
Yeah.
passed away, and very unfortunately. And he's had it, I guess, since the Tulsa rally for Trump about a month ago.
Yeah, they say that they don't know exactly when that happened, but he was at that event. I want to ask you. You said that you had some gastrointestinal issues. So, what was your diet like as you were at your sickest? Were you still able to eat relatively healthy?
Yeah. So my wife and I have always been, well, I've been whole food plant-based vegan for 10 years. And that's how I lost all my weight. And I've been in extreme health. And when I went whole food plant-based vegan, I felt so much better, so much more quickly than I'd ever felt in my entire life. I mean, it was just like I had stepped out of the matrix and I felt so good. It wasn't like I was giving up anything. It was like, wow, I get all this just for doing these basic changes in my life. So I was absolutely committed to whole food, plant-based vegan nutrition, and it's not something that I've ever retreated from or stepped back from. So that's the food that we had in the house, and that's what we ate through the continued to eat through the pandemic and or through our symptoms. And I really feel that that's what's helped us out. The negative lingering part of this was, as I mentioned originally, I did put on about 20 pounds because I've not been able to, I stopped working out when we got sick because I just had no energy and no ability to work out really. I mean, I couldn't pick myself up off the floor, as I mentioned. And that weight gain came fairly quickly. And I don't know if that's caused by the pandemic or just caused by the lack of exercise, or maybe I was eating a little bit more than normal, because my eating really didn't slow down during the pandemic. I didn't experience a loss of appetite. I know that this affects different people in different ways, and there across the country, people are reporting markedly different symptoms from people in other places. So what I got was continue to eat, didn't work out, put on about 20 pounds. Now I'm feeling better, and now I got to get back to work and take that off, and just continue the extraordinary health and happy life that I had before we got sick.
Yeah, you touched on this a little bit earlier during the interview, talking about how different things may have been, if you were still at that 340-pound weight. And that always gets me to thinking about, well, when I was 420 pounds and checking off all of those boxes for the comorbidities that turn COVID-19 into the beast that it can be. Yeah, I really think that, man, I would be terrified to be that size, be that unhealthy, and come down with this virus, knowing that obesity, hypertension, high cholesterol, you name it, is really increasing the risk. I mean, you really have to be counting your blessings here that you were in the condition that you were in.
I completely agree, because 10 years ago, before I started this health journey on a whole food, plant-based vegan diet, I had type 2 diabetes. I was taking about 100 units of insulin a day, and about 15 other medications, including high blood pressure medication, statin, really everything for high cholesterol, high blood pressure, 3 different antidepressants, all sorts of different medications. And I think that it's obvious that if I was not in this level of health from a whole food plant-based diet after I got the virus, I don't know how I could have possibly survived it, because all these like other factors that they talk about on the news that, if you have these underlying factors, well, I had 3 or 4 significant underlying factors that I'm sure would have not been positive for me had I not been on a whole food plant-based diet. So I would like to say that the virus doesn't discriminate. It's gonna infect you or not based upon, if you are in a proximity to somebody and the circumstances apply. You can't avoid getting the virus if you don't social distance and you don't maintain regular sanitary habits and everything that's recommended. You're only reducing your risk of getting it. But once you get it, if you're extremely healthy, you've got a much better chance of seeing it through to the other side with a lower impact than if you have a lot of underlying conditions.
Absolutely.
And yeah, if I could just give a plug also for my mother-in-law. As I mentioned, she's 96, going to be 97 next week. She moved in with us a year ago, and she was obviously an omnivore when she moved in. And when she moved in, she was on diabetes medication, high blood pressure medication, fairly similar to my condition. She had extreme diabetic neuropathy, poor circulation, and had medical issues with that in the past. Just 5 weeks after moving in with us at age 96, eating whole food plant-based nutrition, her doctor, and this is not like something that she decided or I decided, her doctor took her off all of her medications. Now she's happy and healthy. Her whole life has turned around at 96. She's walking 2 or 3 miles a day. She sits out on our front patio and just talks to everybody who walks by on the street. And, her life has been blessed by whole food plant-based nutrition also. So we recommend it for everybody, all ages, all lifestyles. This is good, and this will really help improve your life.
Oh, yeah, absolutely. And you and I are actually going to be continuing this conversation later this afternoon. We're going to record for next Tuesday's Exam Room podcast, which plug. You can head over to the Apple Podcast or Spotify, look for the Exam Room by the Physicians Committee and hit that subscribe button. You and I are going to talk in depth about this, because when you first told me about your mother-in-law a number of months back, I was like, this is the story of all stories that needs to be told.
You. So we'll have her live on the podcast at some point, not today because I haven't prepped her for this, but she's very lucid and she's got a great personality, and I think it'd be a great addition to the podcast for sure.
Oh, fantastic. I'm so looking forward to that. So, but before that, there's a question from a viewer who's watching right now, a woman by the name of Crystal. She wanted to know, had you been cleaning your groceries? That's something that's come up a number of times on the show.
My wife is very sanitary oriented and has been. She generally puts everything through a vegetable wash and wipes down any plastic packages of like tofu and things like that we buy. But we're eating mostly, and I would say at least 80% food in the natural form, of the way that it comes out of the ground or you grow it in the supermarket. We've got a huge garden that we've planted in our backyard. We're aspiring to, this year at least, produce about 1/3 of what we eat in our own garden, and hope to take that up next year. But to answer the question, yeah, we did as best as we could. We both wear face masks when we go out. And let me say something also. We continue to wear face masks, even though our county health department and our healthcare providers have told us that because we've had COVID-19, it's extraordinarily unlikely that we can either be contagious towards other people or catch it again ourselves. But as a common courtesy, we feel that it's important to wear our face masks when we go out, so that we don't create anxiety in other people and make other people nervous. We just feel that it's the cool thing to do.
Absolutely. It's the cool thing to do. I like the way you put that. All the cool kids are wearing them, so we're going to be cool kids too. Daggone it. I like where your head's at. Eric O'Gray. We will be talking on Tuesday's podcast, but right now, thank you so very much for your time, my friend. By the way, your book is extraordinary. I cannot let you go without giving a plug for Walking with Petey, which chronicles your incredible journey back to health. I mean, you want to talk about another story of all stories? This is it as well.
Walking with Petey, the dog who saved my life, available on Amazon and Audible. I narrated it myself. My publisher loved the recording so much that they annotated the recording with animal sounds, where I talk about a dog barking or geese flapping in the background. There's those sounds in the recording. If you like audiobooks, it's a great one.
Oh, how cool is that? I love that so much. Hopefully we'll drop a link off to that in Amazon in the comment section. So Eric O'Gray, thank you so very much for your time. I'm so happy that you are on the mend, my friend, and please give my best to your wife.
All right. Thank you so much. We appreciate it.
All right. Talk soon. Time now to open up the doctor's mailbag. And for that, Dr. Vanita Rahman is here, ready to step into the exam room, answer all of your questions. So let's go ahead, bring her in, and raise our nutrition IQs together. Dr. Rahman, welcome to the show. Thanks for taking the time today.
Thanks for having me, Chuck.
All right. Now get your questions in the comment section right now. Let's fill this mailbag up to capacity and get going. First question, sticking with the COVID theme today. This one comes to us from Eddie on Facebook. He writes, I'm having surgery on Tuesday. What things should I be worried about while recovering in a COVID world?
Yeah, good question. First of all, Eddie, I can appreciate some of the anxiety you may be feeling having to go through surgery during this time. But it's really important for people to know that when it comes to surgery, your healthcare providers and hospitals are taking all the precautions they can to protect you. And after you're discharged from the hospital or the ambulatory surgery center and you come home, it's important to do all of the things that Eric just talked about, that we've been talking about, which is social distancing, wearing a face mask when you're out, and washing your hands when you get home or you've been exposed to anything outside. And, eating a healthy plant-based diet that's going to help protect your immune system from chronic conditions, which will in turn lower your risk of infection or more severe infection. So a lot of those things are the same. And then again, if you experience any fever, chills, or symptoms, please get in touch with your healthcare provider so they can evaluate you properly.
Here's a question coming to us from a viewer on YouTube wondering about fish. Says that there is a misconception going around that fish is healthy. What effect does fish actually have on our health?
Yeah, so, the confusion comes up a lot, and it has to do with the type of fat that fish has. So traditionally, things like red meat or poultry products are fairly high in saturated fat. And we know from decades of research that saturated fat raises cholesterol levels. It increases the risk for cardiovascular disease. Now, fish also has a lot of fat, but it tends to be mostly unsaturated. And so the idea was that unsaturated fat may be healthier than saturated fat, which it is, and it's less likely to raise our cholesterol. But here's the problem with fish. It's still a very high fat food. So if you're trying to lower your blood sugar levels or lose weight, that will be hard with fish because of the amount of fat. Second, it still has cholesterol in it, which will raise our cholesterol levels, which in turn increases our risk for cardiovascular disease. And third, fish has no fiber, and we know that fiber is this tremendous nutrient that most people don't get enough of. And fish, like all animal foods, has none in it. And lastly, there's concern about mercury toxicity and other chemicals that could be found in fish, which are real health concerns. So for all these reasons, even though fish may not be as high in saturated fat as, say, red meat or poultry, it's still important to avoid it because it's nowhere near as healthy as, say, plant-based sources like beans or legumes to get those proteins.
Here's a question from Kenny, posted this one at 12:22, looking to take their health to the next level. Wants to know, what is the best way to study lifestyle medicine?
Oh, well, so first of all, good for you, Kenny, for pursuing this. There are so many resources out there. I know on our website, we have a lot of information about nutrition. We have a Food for Life instructor program that you can look into where you can in turn then help others. And then if you're in the healthcare field, we, like others, also have conferences every year that you can attend and learn more about nutrition and health. And also, if you're not in the healthcare industry, we at the Physicians Committee often have immersions or weekend programs or, programs that last for weeks, 12 weeks or 3-week programs where you can learn more about health and nutrition. So a lot of options. I would say start by going to our website and look at some of the offerings we have. And then there are other great organizations that have offerings too.
1223, this one comes to us from Georgette, wants to know, is liquid amino safe to use?
Yeah, so liquid aminos it's kind of like soy sauce. So you're adding a salty flavor to the food. And the fun thing with liquid aminos is it works great in something like popcorn. So you've popped your popcorn and now it's hard to shake salt on it because it really won't stick. So you can spray it with a little liquid aminos and then maybe add nutritional yeast to it so it gets that cheesy, salty taste without using any cheese or butter in it.
Oh boy. Lisa Swenson here with a great question at 1225, man. Just get ready for this one. She writes, I'm plant-based, but my family seems to be addicted to cheese. Isn't cheese basically like super condensed meat and dairy and worse than eating meat? And what can I say to them to help them understand? My goodness,
Yeah.
a lot there.
Yeah, Lisa, you're bringing up something that a lot of people face. When most people find it the hardest thing probably to wean themselves off of is the cheese, and cheese is addictive. It has chemicals in it that stimulate our brain, elicit a positive response, so we keep reaching for it. But we can break that addiction by not consuming it. So for your family, first, maybe explain why you're doing it, why you have stopped consuming cheese. That might be more helpful than telling them what to do. If they can understand your reasons, that may resonate better with them. Second, offer alternatives. So what is cheese commonly used for? Pizza. And what is really amazing is that pizza tastes great without cheese. So you can order it with tomato sauce and load it up with tons of veggies. I love mine with mushrooms and eggplant and onions, and top it with arugula, and it's great. I don't miss the cheese at all. So maybe try introducing your family to that. If you are kids or family members are into putting cheese on their sandwiches, offer other options like a black bean spread or a hummus spread or a roasted red pepper spread. So many great ways. But the bottom line is there are lots of ways around cheese, and it's just a matter of finding the right recipe, and they might be surprised that they don't really miss it after a while.
All right, time for just a couple of more. This one comes to us from Lentil Addict. They write, I recently turned vegan after being raised vegetarian. How much iron do I really need? I follow the RDA for iron, whereas my relatives say that I need 1.8 times that amount.
Okay, so let me explain this. So the RDA is the recommended daily allowance for iron. That's how much we need to make sure we get enough iron every day. And that varies based on the gender. Women of childbearing age need more. Other adults need less. So usually women of childbearing age need about 18 milligrams a day, but men and other adults need about 8 milligrams a day. So the confusion is coming in. Iron can be found in animal-based sources, which is known as heme iron, or plant-based sources, which is known as non-heme iron. And heme iron tends to be more readily available than plant-based iron. So it is true that for people consuming a plant-based diet, we are advised to eat 1.8 times the amount that someone who's eating an animal-based diet eats. But that's only because of the availability. And also, when you consume iron in plant-based foods, it's important to take it with some vitamin C. So, throwing in some oranges into your meal or grapefruit or kiwi will help you absorb that iron more. So, but most people will get enough. And if you're in doubt, see your healthcare provider and they can screen you for iron deficiency and help you figure out where you need to be.
All right, before we get the final question, every day I see somebody by the name of Dawn, the singing nurse, posting in the comment section. And Dawn, if you truly are a singing nurse, if you could just record a few bars and send them our way, I would love to hear you belt a tune out on the Exam Room Live. I think that would just be fantastic. Okay, final question comes to us from Mary on Facebook. She wants to know, is having a glass of wine once or twice a week all that harmful?
Well, It is according to the American Cancer Society. So the American Cancer Society recommends that we avoid alcohol. And the reason for that recommendation is that alcohol use is associated with a higher risk of many types of cancers, such as those of the larynx or the oral cavity, the liver, colon. And so the safest amount of alcohol is to not drink any. However, if you are going to consume alcohol, they recommend limiting it to 1 serving a day for women and no more than 2 for men. And let me also just say that alcohol use is also associated with other chronic conditions such as high blood pressure, cardiovascular disease, stroke, and then it can lead to chronic hepatitis of the liver or chronic pancreatitis where the pancreas stopped working. So it's not just cancer prevention, but also other conditions can be associated with it.
All right, time now to close up the mailbag. If we didn't get to your question today, have no fear. Go ahead and post them some more. We're going to save each and every one, and we will try to get you an answer on an upcoming show. And Raymond, I see your comments, my friend. I'm sorry that we did not get to your question. If you could post that for me one more time, I did not see it in the comment section. Hopefully we can get you an answer very soon on the Exam Room Live. If you want even more listening pleasure, we just released a new podcast this morning, Dr. Rahman. Stick around. I'm going to come back to you in just a little bit when we talk about the exciting things happening at the Barnard Medical Center. But just dropped a brand new podcast this morning, the Exam Room Podcast by the Physicians Committee, talking about the effects of a plant-based diet and Crohn's disease. Had the opportunity to speak with Dr. Alan Desmond. Now, he is a consultant gastroenterologist and an ambassador for Plant-Based Health Professionals UK. And what Dr. Desmond did is he walks us through how Crohn's disease went from being this pretty rare condition to just exploding with the wide adoption of the standard Western diet. You see that exact connection with that high fat, high calorie diets when they became more and more popular. That's when you started to see more and more cases of Crohn's disease pop up. But the good news is Dr. Desmond also walks us through how a plant-based diet can help combat that and bring all of that inflammation under control. And in some cases, we're even talking about a complete reversal, just as we've heard about with Eric O'Gray's diabetes and other cases of heart disease. So cool, this research that is being discussed on the show today. So go ahead and head over to Apple Podcast or Spotify or Stitcher and hit that subscribe button and leave a 5-star rating if you would be so kind. Bonus points if you share it on a Facebook group, and double bonus points if you also share it on Twitter. Dr. Rahman, I want to bring you back real quick because exciting things are in fact happening right now over at the Barnard Medical Center, if I could find my words. This is great. The number of states where telemedicine and the plant-based doctors and dietitians, your colleagues over there, the number of states where you are actually able to work with patients is just, it's surging right now. I think that there are 5 new states that were added over the last couple of weeks. What are the new ones?
Yeah, thanks for checking, Chuck. So we are expanding our telehealth services to as many states as we can. So we've recently added Florida, Illinois, Georgia, Pennsylvania, and Indiana.
Yep.
And there are more to come, so stay tuned.
Florida, Georgia, Pennsylvania, Indiana, just that's phenomenal. And I think that as it stands now, if my calculations are correct, all told, let me pull up the list here. All told, I do believe it is more than a quarter of the country that is in fact being covered right now. So let me give you the full list of states here. We've got DC, Maryland, Virginia, Missouri, Arizona, Colorado, Massachusetts, and Kentucky, in addition to the new ones, Dr. Rahman, you just mentioned. And to make an appointment, you can head over to barnardmedical.org or pick up the phone and call 202-527-7500. Dr. Rahman, thank you very much for your time today. Greatly appreciate it.
Thank you, Chuck.
All right. Now, coming up August 6th through 8th is a really, really great event. We're talking about 3 days of health and nutrition and cutting edge research, the likes of which you have never seen before. This is the International Conference on Nutrition in Medicine. Now, check out this lineup. Dr. Neil Barnard will be there. He's going to be teaming up with Dr. Christy Cobb to talk about nutrition and sex hormones. And then we've got the rockstar doc, Dr. Shivam Joshi, who was on the Exam Room podcast not too long ago. He will be there talking about the latest on plant-based diets and kidney disease. Dr. Rahman will be there presenting on nutrition and hypertension. Huge right now, especially that high blood pressure is one of the major risk factors for COVID-19. And I absolutely love this one. Doctors Walter Willett and David Katz on the second day will be giving a talk. This talk, in fact, what's behind nutrition controversies? Making sense of the science. How great is that? I love that. I absolutely love that, and I think that you will too. And can't forget, Dr. Kim Williams will be there, Dr. Michael Greger will be there, Dr. Danielle Bellardo, and really, that list is just going and going and going. So August 6th through 8th, head over to pcrm.org/ICNM to register. And as a special offer for you who's watching this right now, our Exam Room viewers, when you register, if you use the promo code EXAM and the number 20, EXAM20, lowercase, you will get 20% off the cost of registration. How about that? pcrm.org/ICNM. Sign up today, save 20% using the promo code EXAM20, and that will be August 6th through 8th. For today, that is all the time that we have. My thanks again to Eric O'Gray for joining us and to the crew that makes the magic happen. Our director today is Emily Colon, and our producer is Donna Steele. On behalf of everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thank you so very much for watching. And until tomorrow, stay safe, take a stand, and keep it plant-based.